Welcome back, moms, dads, and caregivers. Today, let's talk about torticollis. Torticollis is one of the most common diagnoses that we see in our infants, and it's also one of the most treatable, especially when detected early. Torticollis is a tightening of the sternocleidomastoid muscle. This is a muscle that runs along the side of the neck. So, for example, if your right sternocleidomastoid is tight, it will cause two things to happen. There are two bellies of the muscle. One runs along the front and attaches to your clavicle, and the other runs along the side of your neck. So when this muscle tightens, it causes a tilt to the side of the muscle, and it also causes head rotation to the opposite side. So if your doctor tells you your baby has a right torticollis, that presents as a tilt to the right and a preference for your baby to look to the left. Now, you might notice that your baby is constantly looking just to one side. And a way for you to test what your baby's range of motion might be is to dangle a toy above them when they're laying on their back and see if they will visually track it. You can use a toy that makes noise, like a rattle, and you'll want to go all the way from the floor up in an arch overhead, all the way to the floor on the opposite side of their shoulder. Now, babies should be able to turn their head fully to both ways. If you see them getting stuck in the middle or only going a certain amount and then kind of snapping back like a typewriter, that might be an indication that your baby might have torticollis. Some things that you can do at home to help: first of all, vary your child's position throughout the day. You will want to put your baby in a side-lying position to both sides, and what that does is get the baby's head in midline. It also brings the hands together, which makes it a great place for your baby to start exploring toys. Now, when you put your baby on the side that is opposite their tilt, they will probably resist you. A lot of babies will keep trying to put their head up, so just rest with them until they let gravity take over and rest their head. That could be a nice stretch to the side muscle. Another thing you can do is to position toys to the opposite direction that your baby likes to turn. So if they have a play mat and they really prefer to look to their left, put all of the interesting toys over to the right to really grab their attention. Also, if you have a wrist rattle when your baby's awake, you can put it on the hand that is opposite of the way they like to look, and then it will eventually rattle and catch their eye, and that'll entice them to look more to their non-preferred side. Another important part of your baby's day is going to be tummy time. Current recommendations for tummy time are 90 minutes a day by age 3 months. That sounds like a lot, but we're not talking an hour and a half straight through. If you're not even close to that, start off with an hour. So time it out so that you're doing 10 minutes a day for 6 times a day. To make tummy time more interesting, you can get a water mat, or you can get a mirror, place it directly in front of your baby so that they are looking up. Babies ideally will want to be positioned with their forearms underneath them at chest level so that they have something to push up against. And you're going to want to bring their attention straight in front of them so that they're not turning their head to one side or the other. That's strengthening the back of their neck muscles. It also gets them off the back of their head. A lot of times babies that have torticollis end up also having what's called plagiocephaly, which is just a flatness to the back of their head on the side that they prefer to look toward. If you are starting to notice a little bit of flatness, no need to panic. Your baby's skull is still developing and is soft and malleable, so you do have time. And the earlier you detect this, the better. As long as you are staying off the back of that skull, the more you do tummy time and stay on top of your stretches, the more you'll see the back of that skull start to round out. If the flattening is severe enough, your doctor might refer you to an orthotist who might recommend a cranial molding helmet. But hopefully you've caught it on time and you are staying on top of things so that your baby's skull will round out on its own. If your baby doesn't like tummy time, you can always modify it. So chest to chest counts as long as you have their arms tucked underneath and they're actively raising their head up. You can also use a boppy pillow. There are some smaller boppy pillows for littler babies that we like to use. Or you can get a towel or receiving blanket and roll it up and put it at chest level with their elbows in front of it. That blocks them from arching it back. There are some specific stretches you can do for torticollis. One is called the tiger hold, which helps with that tilt. And what you do is lay your baby across in a side-lying position and facing away from you. You're gonna wanna put your elbow in between their ear and their shoulder, and then you just do some gentle raising of your elbow to start tilting that ear toward the opposite shoulder. You can also use your hand to kind of help that, but go slowly and gently. A lot of babies tolerate this position because they're facing outward. They can look at things. You can walk around and talk to them while you're doing this stretch. Another thing you are going to want to do is to get them to rotate their head to the opposite direction. You can do that visual tracking exercise that I talked about at the beginning, but you are going to want to put your hand on their opposite shoulder to block them, because a lot of babies will turn to the side in order to help them track. And we're going to want to go all the way to get that stretch. So that's a little information about torticollis. If you suspect your baby may have torticollis, contact your pediatrician for further evaluation. Thanks again for joining me, and have a wonderful day.